COVID-19 has a huge impact on the fight against HIV, tuberculosis and malaria. It increases already existing inequalities and puts a high burden on communities and key populations. The world was not on track to fight the three diseases before COVID-19. However, its impact should not reverse what has been achieved within the last decades. We need a strong and fully funded global fund based on human rights principles. What we certainly don't need is a fragmented and weakened global health system based on security concerns.
We learned a lot from our interview partners. Let's apply their lessons.
Thank you.
My name is Naomi Wanjiru. I'm from Kenya. I'm a mother of 2 children and I'm a nurse. I work in a TB clinic, stroke HIV. I've been there for 12 years. I've been working with my clients for 12 years and I'm happy to continue working with them because they give me motivation to know that when I see a client walking down and then after a few months he or she is up, I'm very excited. And I suffered from TB and that is why I just want nobody to go through what I went through.
What is the impact of the Global Fund and what are like the main problems in your region?
I was given a chance to live again because of Global Fund. When at first I was diagnosed with TB, I almost gave up. I'm very grateful because HIV, TB, and malaria has really affected our country. Let me say that Global Fund has really helped us, me included. 38 million people all over have been saved by Global Fund. I've been given a second chance. I'm a health worker, and I tell you, I get some salary every end month. What about that person that is not able to provide for even the food? What can you tell that person to go buy medication? I'm very grateful that Global Fund stepped in and decided to provide for this fund that provides medication, that provides psychosocial counseling, that provides psychosocial grouping that people can go when talk about their problems and it is sorted. I'm very grateful that I'm able to give back to the community through Global Fund. Had I died, it would be a forgotten story, but I got healed. And through my healing now, I'm able to go and tell the community that these medications are free. This medication don't have much side effects. These medications are good, just take them and you'll be well. And I can attest to you that in where I work, I have seen people come when they are very down, but currently they are doing their own things. They are walking around, they are providing even for the family, both HIV and malaria and TB. And I'm very grateful. Let me tell you, I got TB of the spine and I was completely bedridden for a whole year. I couldn't walk, I couldn't do anything. And fortunately, there was a community health volunteer who was bringing for me medication every time and chat around with me to give me some strength. And that is how I was able to walk from one step to another, and here I am. So that community health volunteer or a TB champion gave me strength and gave me hope. And the good thing is, I never missed a dose. I never missed a dose of medication. They were all provided and freely. And I'm very happy that Global Fund was able to do that.
What are the key principles of the Global Fund that are most important for you?
If funding is done, everything will run out well. And the most important thing should be accountability. Global Fund is providing and is supporting everyone, but there should be accountability. Let these monies that are provided reach to the community, reach to the person that is supposed to use the funding. TB, HIV, and malaria is in the community. It's not in boardroom, it's not in the offices, it is in the community. Maybe a client comes to the clinic, she or he will take the medication and get healed. But what about the person who is in the community? It is about us to go capacity build those that are in the community. And if we start from the grassroots, the money that is the funding, the grant that is provided by Global Fund will have complete impact.
How did COVID-19 change your working environment?
What I was saying is that everything came to a standstill because of COVID. it was all about COVID. It affected us from the working area, from economic. Everybody was affected. The lockdowns, people are not able to access this medication, the HIV medication. That it took our responsibility to take the medication and take them to the community. And it is our responsibility to be proactive, to be ready for anything. You know, it is not that COVID has come to an end. Maybe tomorrow, maybe next year or next week, we'll hear about another pandemic. The preparedness is very important. What have we learned from COVID? What funding are there to be provided in case there's another pandemic? We should be prepared just in case of anything. And after the preparation, we should not forget about other diseases. They are still there. They're still there. Not that the COVID has come, we forget about HIV, we forget about TB. You can die out of TB and you can not die, maybe you can survive COVID. So they should go concurrently. We should go concurrently. So it is upon us to know, to provide the funding, that will take care of HIV, will take care of TB, will take care of malaria, will take care of COVID-19, and these diseases should be treated the same. And we should be prepared. Let there be money waiting, funding, grants waiting just in case of anything. And also in our hospital, there should be infrastructures. Let's not run the last minute. This money should not be spent by misusing. No, let's be prepared. There are hospitals that can be built just in case of a condition. Today is COVID-19, maybe tomorrow will be something else. Let's set aside money for research. Let's set money for personnel. We've really suffered as personnel, as people working in hospital, the healthcare workers. Most of us, we are overwhelmed because you are expected to go to work, you are expected to take medication to clients, you are expected to be there for your family. We are having a lot of burnout. It is us that we should also have money to employ people immediately there is a problem. You might suffer from a condition, but the condition does not affect you. The stigma itself does. When first I was diagnosed with TB, I wouldn't even tell someone I'm suffering from TB. Why? Because people are not ready to mingle with you. Let me tell you, I injected myself 60 injectables because no one was willing to come to inject me. Why was it happening? Because of stigma. So it is us to capacity build people, to know, to tell people that this is a condition like any other condition.
What is your wish towards our government?
If money is provided, if this funding gets to the community, let it reach to the community so that it can strengthen the Global Fund. Let the fund not just be used by anybody. It is coming to strengthen our health system. If our health system is strong, all other conditions will be manageable. I believe that when I'm healthy, when I'm able to take care of if you provide for me, I get healthy, I'll be able to be economically stable and I will not bother you much. But when I am sick, I will want to depend on you. So it is my prayer that accountability, I believe in accountability so much. The little you are given, what is it going to? I believe in that.